Good morning, everybody. It's nice and early in Jackson Hole, and welcome to Beyond Telehealth. And I'm Dr. Lisa Finkelstein, and I'm going to be your host this morning. And we have this morning Dr. Jared Pelo. He's an emergency medicine physician, and it's an exciting time. He works with Nuance and many products. One we're going to focus on is DAX. So let's jump right in, Jared, and introduce yourself. Tell us what you do, what your specialty is, and how you got involved in this field of technology and innovation.
All right. Lisa, thanks for having me this morning. So I'm an emergency medicine physician, like Lisa said, and a couple years into practicing, I was hating my job. And so I asked my partner, who was the happiest in our group, how do you stay so happy? And he told me, every day I have off, I hate coming back to work. And I was like, well, that was the worst pep talk I've ever heard from anybody. But he said two things. He said, the people who are happiest either go into administration or they try to innovate and make the health system better. So I tried administration for a year, and God bless you if you can do administration and hang in there. You're one of the soldiers we need on the front lines helping the health system.
I call myself a reluctant administrator.
That
like a reluctant surgeon.
Yes. Well, still you're helping. That is, we need administrators, and we need physicians to be administrators, not just business people. So it's super important. So after that year of being the medical director, I started a virtual scribe company, and it was this small virtual scribe company. And the idea came, I was administrator in a hospital that was about an hour away from the mothership. And the idea came in driving back and forth and not having my normal medical scribe with me. I would steal him every once in a while from the mothership and take him with me. And we just started talking like, wouldn't it be cool if we could just do this virtually? And don't you think that computers someday will be able to do this? Like, what if we captured the data needed to actually automate this? And so we started this little virtual scribe company in 2017. We became part of Nuance because they had this vision, the same vision as us. Can we make this kind of ambient intelligence that empowers physicians to focus on their patients and not worry about the documentation? And so that's what Dragon Ambient Experience does. We went generally available a little over a year ago, and we record the whole doctor-patient conversation, whether that's through a telehealth visit or an in-person visit. We record that, and we do all the documentation, currently powered by AI, with a quality review check by a human before it goes into the EHR.
Okay, so let's stop there for a sec. So I told you prior that I'm going to be the skeptic, because us doctors, we are a difficult bunch, and it's hard to convince us. So, I have used Dragon. I can't remember what you guys call it. Power something.
Power Mic Mobile.
Yeah. And so, on the face of it, it sounded great. Like, let's get the app, let's hook it up to your cell phone. And, the typical technology glitches. It goes down, it doesn't work, and then it doesn't record your voice correctly, and then you have to. And so I'll just be from the surgeon's perspective, right? I'm in the middle of it. I finished my case. I got another case, and I sit down and I got this thing that doesn't work. And then I get all pissed off. Yeah. What do you say to that?
Well, we have a few advantages in DAX. So one of our advantages is we don't yet deliver the note in real time. So that gives us some redundancy. Dragon Medical One is a cloud-based service, so you need to be connected to the internet, and it needs to be streaming. It needs to happen in real time. And Dragon Ambient Experience can record in an offline mode even. So if you're at the hospital, if you're in the clinic, the internet goes down, even your EHR could go down, and you could keep using DAX. you could keep recording your conversations, and you can actually upload with cellular. And then as soon as those recordings hit our cloud, that's when all the work starts to happen. So the AI starts writing the note. After the AI writes the note, it goes over and we do a quality review check, and then we put it back in your EHR for you. So we've stacked the deck a little bit for our success at this point.
But isn't that still clunky?
So it's not as smooth. So this is my vision of magic, right? My vision of magic is I'm talking to my patient, and say they have something that there is like a medical scoring system for. I want to see that score like auto-populating from data from the EHR and data from the conversation. And I want to see when I mention, I'm going to put somebody on Flomax, I want to see that pop up on my EHR ready to be ordered. And, that's the magic that we're heading towards.
Right.
Where we're at today is we take care of the heaviest lift, the documentation of the whole visit. And so if you are there talking with your patient, you can pay 100% attention to the patient. You do have a delay on getting that final note back to you, but when that final note comes back in, it's practically 100%. You read over it, you sign it, and you didn't spend the 5 to 10 minutes dictating on Dragon Medical One, which is a great product. But if you want to save those 5 to 10 minutes every time, and you add that up by 20, 30 patients a day, that's where Dragon Ambient Experience kind of comes in.
So that's my other question is, how much time do you think that this saves?
Mm-hmm. Yeah, it depends on, who you are and what kind of visits you do. So, if you do 10-minute visits and you document for 4 minutes, it's not going to save you 10 minutes of documentation time.
Right.
But it might save you 2 minutes. But if you do 45-minute visits and you document for 25 minutes, it's going to save you, 20 minutes. So it kind of depends where you fall. Now, if you're doing 10-minute visits, you're doing a ton of patients and a ton of documentation. And so it adds up either way,
right,
on the time savings.
And then the delay of the note, is that a day?
So it's 4 hours. And part of that is we can do that faster than like traditional transcription or something like that, because the AI is writing the note. The AI writes the note, and we call these people quality documentation specialists. They do the quality check and make sure that it's.
So that's an actual human being, like a transcriptionist that's used to looking at this kind of stuff.
Right. Yeah.
Wow. It still takes a village, right? I mean, it's kind of, it's so, my husband is an anesthesiologist, and we've talked about, leapfrogging over all this stuff and just recording, just like we're doing right now. Yep. And just recording the visit, sort of like, what's happening with police and everything else in the world. And a lot of physicians say, nah, that's not a good idea. Mm-hmm. What's your feeling about that?
I'm kind of plus or minus on it. So as far as recording, I have no problem recording. In the hospital, we do it a bunch. In the ICUs, in the emergency departments, we're already recording traumas and codes and all sorts of things. I think video is becoming more commonplace in the hospital. And of course, we record all the audio of these visits. So I don't think it's a bad idea to record. The recording as the medical record, my biggest problem is data. We want actionable data from the medical record. And that's the whole reason we went with the EHR. It was because we had all this data, but we couldn't make it actionable. But then we made the EHR so painful to deal with that physicians are unwilling to put the data in to make it actionable.
Right.
So I like the idea of recording. It's just not what I would use for the final record to make it actionable.
Yeah, it's pretty fascinating. I mean, we have to get back to a point where physicians, as one of your videos said, turns the chair back to the patient. I love that analogy. as somebody who is head of telemedicine, I'm still a urologist that loves to touch people. So this whole, pathway into innovation and technology has been hard for a lot of us.
Mhm.
And it's very difficult to convince physicians. And like I said in the beginning, thank God for the pandemic, because we couldn't convince physicians to embrace the technology, to allow that to help them see patients more efficiently and engage with patients better. So what's the elevator speech to say to them? This is great.
Well, Lisa, you bring up like one of the hardest things about selling a physician on a new technology is they've been burned so many times, right? Like how many times have we heard like this technology is going to make your life so much easier?
Right.
And then we start using it and we just wish, like, I wish I could go back to a paper chart. Like it was so much easier for me. Like, sure, I had to hire staff to like bring me the chart, but the chart was there. Right. Yeah. And so I think we're getting to a point that's super exciting to me where you start to see these AI breakthroughs. And we are on this exponential growth of technology that sometimes we forget about. Like, especially, we've had the internet now for a good 25 years. And we have such a powerful computer in our pocket, and we have all these things that just seem like they're normal now. But 25 years ago, they would have been fantasy. And I think we're at a similar point where like 5 years from now, we'll look at the way we practice medicine and we'll look back at today and we'll be like, I can't believe I practiced medicine like that. It was so painful. And it'll just be common. It'll just be normal for us to talk to our patient, touch our patient, and have things documented for us, have actions set up, have appointments set up, all the things that we spend time on that have just been kind of piled on us more and more and more. Those things will be offloaded, and finally technology will be what's saving us, not what's slowing us down.
Well, and not even touching our patients, which is another strange thing. And it took me a couple of years to, for me to even come around. But I say to doctors, like, if you're honest with yourself, when we make a diagnosis of prostate cancer, what part of that is actually having to examine a patient or touch a patient? Mm-hmm. So if it's 20% where we do a rectal exam and a biopsy, and the rest of it is just looking at imaging and education, we don't really even have to bring patients into the office. So this whole paradigm of shifting where we're so used to bringing the patient to us, bringing the patient to the hospital. And so the analogy was, whoever thought that we would never go to a bank again, that we now can do all our banking on this. Well, right. I agree with you. As much as we are resistant to say, talk to me in the future is now, guys and girls. And either you embrace it or you're going to be left behind. The other question that I have opinion is, so I've started talking to or lecturing to medical students on telehealth and telemedicine. And I honestly think that's where this needs to start, with the kids that are coming into school. So what's the vision that you guys have for medical students?
That's a great question. I bring it up with my team all the time. I tell them we need DACs for medical students. We need DACs for residents. So far, I haven't converted a bunch of people. So but that's exactly where I want to go. And then the second thing, I just want to echo what you're saying. Like, I think telehealth, there are some really powerful things with telehealth. And one of them might be telling somebody bad news. And do they want to be in your office and then have an hour drive home? Or would they rather be in their home with their loved ones? And I mean, some are going to want to be in your office.
Yeah,
But
that's a tough one.
but but some are going to want to, be in a comfortable place, be in a place that they feel comfortable where they're able to deal with those things differently. So I think telehealth is such a powerful tool that, we're just getting to understand. Like you said, like it's like the early days where now we have an ATM in the bank, and pretty soon there's going to be more and more and more delivered just through your phone, just through the computer. So I think it's really exciting.
Yeah. I mean, the retail industry, banking, and so we've got the companies, Amazon and Google. So the other the other thing I wanted to ask you was the Microsoft situation. Are you excited about that? I mean, is that sounds to me like you hit the jackpot.
Oh,
How's
I'm ecstatic. I'm ecstatic. We've been working with Microsoft now for maybe 18 months and work day in and day out with that team. They're super high quality scientists, professional people. Like they've been just a joy to work with, and they have the same vision. And that vision is really connecting people. Like, how do you use technology to connect people, allow them to serve the mission that they feel called to in life? And if that mission is to heal or to help others, like how do you allow a physician to do that with technology? So it's been a joy to work with them so far. I'm super excited for the deal to go through and kind of officially integrate with the Microsoft team.
So the skeptic again says that, these companies, same thing that we've been burned with the EHR, where the whole premise was to connect, to be interconnected, to be all networked. So we didn't have to be redundant, and it has totally blown apart.
Yep.
So you have the Microsoft wonderful, wonderful people with big hearts and kind hearts, but speak a different language than us. So looking back at the mistakes that were made with the EHR, what do you say to them? Like, let's not repeat this, people. How do they, yeah.
I think they recognized that as they went into the healthcare space and started really working on hard problems. I think they looked around and said, healthcare is a space we have some expertise on, but who's even more expert than us in healthcare technology? And when you think about healthcare technology like AI, like Nuance and Dragon and all our suite of products are kind of like top of the board. And so I think that's why they targeted, like, let's talk to Nuance. Let's see what it's like to work with them, what kind of insights they have into healthcare. So I think that's it, where they're not going to just go into healthcare without a really clear expertise. They have this really clear expertise that they're making a part of their company.
Right. Well, you need to convince our physicians at our hospital on this ambient technology. They just they're not ready to buy in. So it'll be interesting to see how this moves forward. On the face of it, it sounds like such a great idea to have, not have to wear. I mean, I stink at typing. This whole technology thing is hard for me, being that I'm the medical director of telemedicine. It's kind of ironic, but I'm so for it. I remember when the Da Vinci came out in urology in 2000, and I trained in Michigan, which is where it was first introduced. And I remember the urologist, there was like 200 of us sitting in the audience thinking, no way. Like, what is this thing? And, kudos to those urologists that jumped in and embraced the robot. And, I mean, it has its negatives, but I remember seeing it thinking, this is going to be phenomenal. So I'm excited, really excited to see where AI takes us. Let's end this with give me like where we're going to be in 1 year and 5 years.
Yeah, so I think I kind of laid out the 5 year, right? That magical, like I'm having that conversation with the patient and stuff is just happening.
Right.
And I get to decide what I share with the patient. What do I want popping up on the screen between us so that there's this collaborative help giving and taking kind of conversation happening between me and the patient. And then in a year, I think we'll be at a point where we're having some of these AI notes go directly to the physician. So I think you'll have turnaround time within seconds of that note.
That'd be great.
It won't be an hour anymore with a quality documentation specialist. It'll be high enough quality that a physician will just take it and say, this looks great, I'm going to do this myself. So
one other question, what about cost? That's the other thing about EHRs that, yeah.
Mm-hmm. Yeah. So, I mean, there's a range of different solutions in how we sell this, depending on how much people want to use, how many other providers are going to use it with them. But it's much less expensive than like paying for a scribe or paying for a person in your office.
Okay, so it's affordable.
Yeah.
All right, well, let's leave it at that. And just hang on for one more minute, but I'm going to end the broadcast.
All right.
Okay, thanks, Jared.
Thanks, Lisa.
Yeah.